Hello everyone and welcome back. My name is Michelle and today I'm going to be covering a crash course on developmental dysplasia of the hip. Here is a basic breakdown of today's contents. Firstly, covering the risk factors. So risk factors that contribute to the development of DDH include family history, a breech presentation, female, and firstborn. So especially for the first two, if there's a positive family history or if the child is a breech presentation, they have a 10 times increased risk of developing developmental dysplasia of the hip. Clinical presentation of DDH is usually separated into two periods, the early neonatal period and the later period, which is beyond 6 months of age. In the early neonatal period, if they present during this time frame, they would usually present with a decreased abduction, asymmetrical skin folds by the buttocks, positive orthopaedics test, and positive Barlow test. If they are presenting a bit later, beyond 6 months of age, they usually present with decreased abduction, with excessive internal and external rotation. They can be late walkers with leg length discrepancy, telescoping of the leg, Trendelenburg gait and sign, and limping. For investigations of a suspected DDH, X-rays or ultrasounds would be appropriate. The ultrasound is usually the first-line investigation for a suspected DDH for a child that is below 3 months old. And if the ultrasound is abnormal, but the child was clinically normal at birth, then we would wait 6 weeks before we start any further investigations, as the suspected DDH would most likely improve. The management of DDH depends on the time of diagnosis. If the diagnosis was made between birth and 6 months, then we would manage with a Pavlik harness. If diagnosed between 6 months and 18 months, that would need a closed reduction and speaker. And if it is diagnosed beyond 18 months of age, then an open reduction or a femoral pelvic osteotomy would be needed. Okay, thank you. That brings us to the end of today's crash course. I hope it really helped. If I left anything important out, please leave your thoughts in the comments below, and I will see you next time.